What started in the early 1990s as an idea among two best friends is today one of the leading healthcare operations around Youngstown. Southwoods Health has gone from one small building to a multi-building campus, and today Southwoods expanded again. Tonight we hear from those two best friends, neither of whom thought it would ever get this big.
Let's cut this ribbon and let's start the party. Here we go. Thank you, everybody.
Orchestrating this evening's ribbon cutting was Ed Moransky, CEO of Southwoods Health, which has now added a pain and spine center to its portfolio. Standing nearby, Dr. Lou Liris, Moransky's best friend, who together in 1994 created Southwoods when Moransky owned a building and wanted to open an MRI.
And I go, forget all that. Open up an outpatient surgery center, make it more efficient and maybe physician-owned, and you'll have people coming like crazy.
So in June of 1996, the surgical center at Southwoods opened.
That was piece number one. It was a little 15,000 square foot facility. I think we employed about 50 people at the time. And
I'd be the only one operating, only one working, and there's like 6 of us, 7 of us. Well, we're done for the day. It's 10 o'clock in the morning or 10:30.
But eventually, people did come like crazy. What followed was Southwoods Sleep Centers, then Southwoods Imaging. Buildings were constructed to house all the doctors. Today, Southwoods has over 500,000 square feet and close to 1,000 employees.
You can't see anything above here, but our nurses can see you and can watch you all the time.
Angela Kearns, the chief of nursing, showed me around the new pain and spine center with the latest technology and most modern methods. The procedure rooms can be set up to a doctor's liking.
Every doctor has their own preference of where they like to be in the room, how they like to set up. Some are right-handed, some are left-handed.
We have clinically provided, I think, a level of care that I hold to be as good as anybody in the country.
it always starts with a need in the community, and then it matches up to, does it make sense business-wise?
This is an entity that's keeping private practice alive. If it wasn't for Southwoods in Mahoning County, I tell people, we'd all be employed by one of the hospitals because we'd have nowhere to go.
The next edition for Southwoods, one of its primary care offices will be converted to express care for medical care without an appointment and on the weekends. It's coming this summer.